morning. Today we are going to talk about postcoital bleeding or bleeding during intercourse or during sex. So it is normally called postcoital bleeding. As you can see from this our topic here. So today we are going to use the digital whiteboard. So this bleeding it's not your period. So it is not normally your period, and it normally occurs during or right after intercourse. So, and there are four causes in here that I have tried to highlight for you so that you can be able to understand where is this problem coming from. Number one cause is from your vaginal area, vaginal causes. And these ones can be, for example, if you are too dry when you're having intercourse, like there's no wetness, and then there's too much friction, or there's some infection. So dryness, and then if there's too much friction, like the act is very like rough. I know there's some people who like that, but this can also cause this bleeding. And also if there's some infection, this one can also cause bleeding during intercourse. So that is the vaginal causes. And then when it comes to the cervical causes in here, my body is gonna be a little bit that way. So for cervical causes could be some, if you have some inflammation on your cervix, for example, maybe you have something like cervicitis, and then if you have any other types of infections, polyps, things like that, could also cause bleeding, postcoital bleeding, that is bleeding during intercourse. And then we have uterine causes in here, and these ones can be maybe if you have some fibroids. There's a video I did about fibroids. Maybe you can check out the different types of fibroids, because not all types, depending on the location. Some you may never have this problem. So fibroids could be one of them. And then if you have hormonal imbalance, for example, your estrogen, if your estrogen is very low, you're gonna also have this problem. So the cause can come from the vagina, your cervix or uterus, or your due to hormonal imbalance. And then let us look at some of the red flags that you should actually take note of, so that you can go and have a checkup if this occurs to you, or if you're having this, like when you're having